Do you know you can still bleed, experience your period, but you are not ovulating? According to the National Institute of Health, 30% of female infertility as a result of no ovulation. And the medical term for no ovulation is anovulation. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, we are going to be talking about anovulation. Yes, and that is no ovulation. I'm going to be talking about the causes, how ovulation takes place, and also why a lady is likely to see her menses, but she is not ovulating. But before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, which is your health, kindly click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy saying thank you. Let's go there. All right, welcome back. Happy to see you here today. So the first question is, what is anovulation? In simple terms, anovulation means a lady is not releasing egg. Yeah, anovulation simply means a lady is not releasing egg. And we all know that as a lady, during your reproductive age, you are expected to release egg monthly. But if there is no release of an egg by a lady, we say this lady is experiencing anovulation. And we also know that if there is no egg, a sperm cannot meet the egg, fertilization cannot take place, and a baby cannot be formed. But before I tell you the causes of anovulation, I would like to explain to you how ovulation takes place. You see this word we keep saying, ovulation, ovulation, ovulation. Ovulation is a complex process. Why did I say that? It's a complex process because it involves a lot of glands, it involves a lot of organs, and it involves a lot of hormones in the body. You see, hormones are messengers. You send a message, they go, they deliver. So ovulation involves a lot of hormones, it involves a lot of organs, it involves a lot of glands. It's not just the reproductive organ that's down there that's responsible. So I'm going to be explaining to you how this ovulation takes place. Ovulation that takes place that you see that we keep talking about begins from the brain. Yeah, the brain. There's a part of the brain known as the hypothalamus. The hypothalamus. The hypothalamus releases a hormone known as gonadotropin releasing hormone. For those that are not in medical school, it might take some time for you to understand, but I'm going to break it down because I want you as a lady to understand what is going on in your body. So there's a part of the brain, like I earlier said, called the hypothalamus. So the hypothalamus releases this particular hormone known as gonadotropin releasing hormone. So this gonadotropin releasing hormones goes to a gland called pituitary gland. Again, when it gets to the pituitary gland, it stimulates the pituitary gland to release two hormones. And these two hormones, they are known as follicle stimulating hormone and luteinizing hormone. You can see this is ovulation. For it to occur, these things must be in order. So these two hormones now, follicle stimulating hormone and luteinizing hormone, they now travel straight to the female reproductive organ, down. They travels to the ovary. So follicle stimulating hormone goes to the ovary to make sure that those follicles, they mature into the egg that will be released. They are responsible for the maturation, that's the growth, let's say the growth of that egg, to make sure that they are ready to be released. That's why it's follicle stimulating hormone. So when they are ready to be released, there's a particular hormone known as luteinizing hormone. It's the luteinizing hormone that now makes the egg to be released, and we say, oh, this woman has experienced ovulation. This woman is in her ovulation. So during ovulation, there's an increased surge of luteinizing hormone. So you can see now, it all begins in the brain. It's not just estrogen. We're not talking about estrogen. We're not talking about progesterone now. We're talking about luteinizing hormone. We're talking about follicle stimulating hormone and things like that. You can see ovulation doesn't just wake up and happen. A lot of things actually take place that you need to take note of. So for somebody to say, oh, I am experiencing anovulation, it simply means there's something in this pathway. Something is wrong in this pathway. Something is happening in this pathway. Yeah, something might be wrong with the ovaries. If something is wrong with the ovaries, even if there's a lot of follicle stimulating hormone, there's luteinizing hormone, releasing egg might be a problem. If there is not a lot of egg, there's something wrong with the follicle stimulating hormone. There's something wrong with luteinizing hormone. There's even something wrong with the brain, the hypothalamus. Releasing egg might be a problem. So if there's any issue in this pathway I just listed, a woman is not going to release egg, because ovulation generally is a complex process. I just hope I've been able to break it down for you to understand. So then that take me to the major why we are here for this video, why an ovulation is likely going to occur. So the first reason that's going to make an ovulation occur is the one we are familiar with, and that is PCOS, which is polycystic ovary syndrome. I've made a video several times on polycystic ovary syndrome, where I explain the causes, where I explain what it is. You can watch the video, or I'm going to be leaving the link to that particular video in the description box below. So for people experiencing polycystic ovary syndrome, they don't have this regular cycle. They don't have regular cycle. They might see their menses this month, and the next month they are not going to see. The next 2 months they might not see, and they see it in the next 3 months. Things like that. They don't have a regular cycle. So polycystic ovary syndrome is one of the major causes of female infertility when it comes to anovulation. The second one I would like to share with you is premature ovarian insufficiency. This actually occurs when a woman's ovary fails before she turns 40. It is also known as premature menopause. You get, but people with this premature ovarian insufficiency, 5 to 10% of these women are likely going to conceive naturally, but this is also a cause of ovulation. Then that takes us to the third cause, which is the hypothalamus or pituitary dysfunction. So like I earlier said, if anything is wrong in this pathway, like the brain, the hypothalamus, something is wrong with the pituitary gland, definitely ovulation is likely going to be affected. So when there is hypothalamus or pituitary dysfunction, definitely eggs will not be released. Then that takes us to the fourth cause. The fourth one I would like to share with you is diminished ovarian reserve. Yes, at birth, every woman has the number of egg they will ever produce. So for every female child you see, the amount of egg they will ever produce is already inside of them. So over time, this egg diminish, they become fewer. So if you are at that particular age where you are experiencing diminished ovarian reserve, that can result in an ovulation. But sometimes women with diminished ovarian reserve might be able to conceive naturally and also give birth. We're going to be talking about the treatment at the end of this video, so watch till the end. Then another cause of anovulation is hypothalamic functional amenorrhea. Hypothalamic functional amenorrhea. And this can be as a result of stress. Yes, stress can result in anovulation. This can also be as a result of exercising too much. For all those ladies that do a lot of gym, do a lot of exercising, do a lot of hard job, that can result in anovulation. Then another I would like to share with you is excessive BMI, excessive body weight, or high BMI. Yes, let's use that word, high BMI. For those that they are obese, they have high body mass index, that can result in anovulation. And not just high BMI, also low BMI, low body weight can result in ovulation. And I also want to let you know that eating disorder, anorexia, can result in ovulation. Then that takes me to the last point which I want to share with you, and that is a natural thing. It's a thing that occurs naturally, and that is menopause. Yes, menopause occurs naturally. This is where women don't see their menses anymore. Like if you're a woman for 1 full year, you've not seen your menses, you might just be in your menopause stage. So during menopause, most women, they don't ovulate, and that is in ovulation. I hope I've been able to explain to you the various causes of in ovulation. There's something I want you to note as a lady. I've listed all this. That doesn't mean that, oh, it's something that you should worry about or start thinking about. Yes, sometimes we miss our period between the months during first period, when we have a lot on our decks, when we are doing a lot of football, a lot of exercise that strain us on us, that can actually result in ovulation. But if this is happening for a long period of time, I would advise you speak with your doctor and, if possible, get necessary treatment, especially if you are a lady trying to conceive. Then that takes us to the signs you should take note of when it comes to ovulation. And one of the obvious signs is no period. Yes, I mean no period, no menses. So if you are a lady, you're experiencing no period or irregular menses, you see your menses this month, next 2 3 months you're not seeing your menses again, or that's when you see the next one, that could be a sign, that could be a warning sign. Then the second is no cervical mucus. Like I will always tell a lady, one of the signs of ovulation is cervical mucus. So if you're a lady and you're not seeing cervical mucus and you're not also having a regular cycle, that could be a sign of ovulation. And if you're having excessive bleeding or light bleeding during the menses, you see that, you say, oh, this is period, that could be a sign of in ovulation. Then that takes me to the question that keep bothering a lot of ladies, and that is, Nurse Mercy Mary, I see my menses, but I am not ovulating. Yes, it's possible for you to be bleeding, but you are not ovulating. What you are seeing, that bleeding you are seeing, is not menses, but rather it is known as abnormal uterine bleeding. It is known as what? Abnormal uterine bleeding. So it's not your menses. Like I always tell you in most of my videos, for you to menstruate monthly and regularly, definitely you are ovulating. But if you're having irregular menses, you're having some bleeding in between or something, that could be abnormal uterine bleeding, not your normal menses. And I would advise you speak with your doctor and get treatment. Then that takes me to the treatment I would like to share with you. One of the treatment that I will advise people to do, the first one is lifestyle changes, lifestyle modification. Yes, for example, you are obese, you are overweight, I would advise you try everything within your power to cut down extra pounds. Yes, because several research has shown for both the men and the women that having excess weight might likely reduce your chances of being fertile, might reduce your chances of getting pregnant. So cutting some extra pounds from your weight is going to go a long way to help. And also, if you are exercising too much and you want to get pregnant, it's advisable you cut down on those exercise. If you're having low BMI, low body weight, it's advisable you eat more nutritious food to help you conceive naturally. So lifestyle modification go a long way to help with ovulation. Then the second one that is likely going to help, your doctors are going to be prescribing some medications for you, such as clomiphene citrate. Yes, clomiphene citrate actually helps to stimulate the ovaries to release a lot of eggs, so that fertilization can take place. So your doctor might prescribe clomiphene. They might give you some HCG, which is human chorionic gonadotropin medications. They might give you your follicle stimulating hormone medications. So this follicle stimulating hormone will help your ovaries to mature the eggs and help with the release of things like that. And sometimes surgery might be done for those that have PCOS, depends. That is why if you are experiencing any of these signs and you are suspecting that you are not ovulating, it's advisable you speak to a fertility expert or your gynecology, your obstetrics and gynecologist team. They are going to be in a better position to help you and give you useful advice. So for those that have been asking, I hope I've been able to break this down to your understanding. But if not, you can drop your questions on the comment section, and when the video is uploaded, I'll be able to take as much questions as I can within the first 7 days. And after the first 7 days of a particular video, answering your questions might be very cumbersome. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video.